Okay, so next is the assessment of the ears. Alright, you're going to check the external ear first. So you're going to inspect for color, size, and positioning. The color should be the same color as the skin on the face, and the size varies. Abnormal sizes could be related to abnormalities or congenital defects, but it could also be a familial trait. And then positioning, the biggest thing there is you're going to draw an imaginary line, which in this case I'm going to actually draw a line with my finger from the inside of the eye around to the ear. And you want the top of the auricle to be at or above that line. So in this case, she's good as far as positioning goes. You're going to look at the color. So the color is correct. If it were blue, correct. If it were blue, you would think something like cyanosis. If it were really pale or really red, you would think something like vasomotor instability. Or excessive pallor is a sign of frostbite. Some lesions you might see is tophi. That's a sign of gout. You might also see sebaceous cysts. Those are signs of blocked sebaceous glands. And cauliflower ear, which is a sign of blunt force trauma. You also want to look for any exudate or any drainage. In this case, you can't see any, but maybe if I shine a light on her ear. So obviously, we don't typically drain large amounts of stuff from our ears. If you see anything like blood coming out of an ear, then that's abnormal and not a very good sign. So the next thing you're going to do, can you see it okay?
Mm-hmm.
Okay, is palpate. So you're going to check for tenderness. Do you feel any tenderness?
No.
Or pain? You're going to fold over and make sure it folds back. If it didn't, then that would be an abnormality. You're going to pull down on the lobe. Does that hurt?
No.
If it hurts, that would be an abnormality or a sign of an infection in the ear. Okay, up next is the exam with the otoscope. So, to do this exam, you're going to have the patient lean her head slightly in the opposite direction. You are going to pull back the ear. You're going to pull up and back the ear. And you're going to look inside the ear. You're going to look for drainage, swelling, scaling, and lesions, all of which would be abnormal. You can look for cerumen, and that's earwax, and that can be pretty much any color and consistency, but it doesn't usually have an odor. So again, you're going to be in the ear looking, and you're going to be sure not to push very hard as you might hurt them. And you're going to look for the tympanic membrane, which is translucent and a pearly gray in color. There are no perforations in a normal tympanic membrane. So the abnormal would be like a bulging tympanic membrane. In that case, it would be more conical than a normal tympanic membrane, and there would be a loss of bony landmarks. And then the refractive tympanic membrane would be more concave, and the bony landmarks would be accentuated. That's all on the otoscope. Next is the hearing. So the hearing test we do first is the whisper test. And the whisper test, in this case, we're going to have her plug up her right ear with her finger, and you're going to whisper a series of letters and numbers in her ear and have her repeat them back to you. Okay, so what did I say?
DMJFRL.
Okay, and so if that's correct, then she passes. The abnormal would be if she missed all or some of what I told her. Alright, next, this hearing test will be with the tuning forks. And so you're going to have the Weber exam. And the Weber exam tests for unilateral hearing. So you are going to strike it and put it in the center of her head. And so what you're expecting is that she hears it in both sides equally. So do you hear it on both sides equally? Okay. So if she hears it better on this side or better on this side, then obviously there's a unilateral problem. Also key is to do it and hold it by the end, because otherwise you messed it up. Just because I did that. Okay. The next test tests for how she best hears conduction is the word I'm looking for. Conduction through bone or through air. So to do this, you're going to strike the tuning fork and then hold it against the bone. And you're going to time, and she's going to tell you when she no longer hears it.
Yeah.
Okay. And so then you're going to strike it again, hold it outside her ear about an inch and time it. And she's going to tell you when she no longer hears it.
Yeah.
Okay. And so in that case, she heard longer in the air, so she hears better with air as a conduction. Okay? Alright, the next part is the lymphatic system. So, it is key to say that in a normal physical assessment, the patient would be nude and wearing a drape. But this is my mom, and there are obvious reasons that we're not doing that, other than the fact that somebody else is going to see it. Okay, so we're going to pretend. So you're going to inspect along the normal sites for visible lymph nodes. And so you're going to look around the neck especially, and around the collarbone. Don't see any. Okay, then you're going to palpate. So you're going to start first. You're going to have to move back here. The occipital point. And you're going to use the pads of these 3 fingers to lightly palpate to feel for any nodes. And so concerns would be, if the node, you expect a little give in the nodes. If they are fixed point, that is cause for concern. If they are enlarged or painful, or if it's tender when they are palpated, then that is also abnormal. So you're going to move on from the occipital point to around, you probably want to go on this side now, to get the post-auricular. You're going to palpate there. And then you're going to palpate here, the pre-auricular. And then you're going to go down to the parotid. Then you're going to move down further and get the submandibular. Do you see it okay? Mm-hmm. And then right around under the chin is the submental. Alright. Then you are going to move down the neck. So you're going to get the superficial cervical. You're going to palpate. Then you're going to palpate in the back for the posterior cervical. Can you see? And then you're going to move down to the supraclavicular. Again, abnormalities would be tenderness, enlarged nodes, pain, or a fixed node. Okay, so from here, you're going to lift the arm up. No, don't lay down. Lift the arm up, and you're going to check axillary. And don't feel anything there, so you're going to move down and check the epitrochlear right here. You don't feel anything there. Can you see okay?
Come around the zone.
So the elbow's here. Okay. And then you're going to have the patient lie down. to check the inguinal, which the inferior and the superior. So the inferior is going to be more inside the thigh, and the superior is going to be more on top of the leg. And then you're going to move down to the popliteal. And the best way to do that is for them to flex. And you're going to get up under the knee and check there. All right. Lift that, Mom. So more abnormalities would be if she weren't dressed and you saw red streaks, that's abnormality. Or if you saw edema, either unilateral or bilateral, it can be pitting or non-pitting. And both of those are signs of problems with the lymphatic system. The edema, of course, could be related to various other things, but